Blood flow is defined as the volume of blood flowing through a vessel, an organ, or through the entire circulation. It is measured in mils per minute or liters per minute. Recall that blood flows along a pressure gradient from high pressure to low pressure. The equation for flow is listed here, where F stands for flow, and remember that will be mils per minute. The delta P stands for the pressure gradient. The greater the pressure gradient, the greater the flow. We'll come back to that. R stands for resistance to flow. This is anything that's going to slow down flow. If you write this as a fraction, delta P is over R. If I increase the pressure gradient, flow will increase. However, if I increase resistance, flow will decrease. In talking about resistance, we'll be looking at the systemic circulatory system. Because most of the blood vessels are within the systemic circulatory system, away from the heart, resistance can be replaced by total peripheral resistance, or TPR. Let's look at some factors that influence blood flow. The pressure gradient, as mentioned before, and we're going to come back and look at that later. And resistance. This is what we're going to look at now. There are three types of resistance. Recall that when we're talking about resistance, we're going to refer to the total peripheral resistance, the resistance in the systemic circuit away from the heart, in the vessels away from the heart. The three factors that influence resistance are blood viscosity. Thicker blood flows slower than thinner blood. Compare water and honey. Recall, viscosity refers to thickness. What is the condition where you have an increased hematocrit? Recall from the blood chapter, it's polycythemia. A second factor is vessel length. The longer the length of the vessel, the slower the flow. Compare a short garden hose to a long garden hose. If you turn the faucet to the same amount or the same opening for both the short and the long hose, the water is going to come out of the short hose at a faster rate, so flow will be greater in the short hose. Vessel length is not an issue when you're an adult. It is only an issue as you grow. So infants, their vessels will have a lower resistance, meaning that they will need a lower blood pressure to propel the blood through the vessels since there's less resistance. However, for you and I as adults, our vessels do not grow. So we can basically ignore vessel length, and also we can ignore blood viscosity. So under normal conditions, you're going to maintain your blood viscosity within the normal range. So you're going to maintain homeostasis. What we're going to focus on is vessel diameter. Throughout the day, you regulate the vessel diameter in order to determine where blood flows and return the blood back to the heart. The smaller the diameter, the greater the resistance. And this is because the blood is going to come in contact with more of the vessel wall, and the friction of the blood coming in contact with the vessel wall will slow the flow of the blood. Vessel diameter is regulated primarily in your arterioles. Recall that the arterioles are the smallest of your arteries. The reason for this is because your larger arteries don't offer much resistance. The diameter of the vessel is regulated by the smooth muscles of the tunica media. When the smooth muscles contract, vasoconstriction occurs. When the smooth muscles relax, vasodilation occurs. The smooth muscles in your blood vessels are innervated by the sympathetic nervous system. Smooth muscles in the blood vessels are slightly contracted, and this is called vasomotor tone. This will allow you to contract them more to bring about vasoconstriction, or to dilate them or relax them more to bring about vasodilation. So it's important to have minimal sympathetic input to the smooth muscles for this vasomotor tone so that you can either vasoconstrict or vasodilate. Let's review. Remember what determines the total peripheral resistance? There are three factors. See if you can name them. Blood viscosity, vessel length and the diameter of the vessel. And remember, you regulate the diameter of the vessel on a regular basis throughout the day through vasoconstriction or vasodilation. This is how you're going to control flow, how you determine where blood is going to flow, and this is also going to impact blood pressure. I've drawn this illustration. In the center, you have a main artery, and coming off of the arteries, you're going to have smaller arteries, the arterioles. So the arteries feed the arterioles, and in this case, the side branches, the arterioles, are going to be feeding non-essential organs. Let's look at what happens when a patient is hemorrhaging or losing blood. You want to make sure that you maintain blood pressure, returning the blood back to the heart. Remember, blood flow goes along a pressure gradient. You have to return the blood back to the heart in order to oxygenate it and to get rid of the carbon dioxide so that you can then send the blood, the oxygenated blood, back to the tissues. When a hemorrhage occurs or when you lose a large volume of blood, the arterioles feeding the non-essential organs will vasoconstrict. This increases resistance, and based on the equation that you learned, if you increase resistance, this will decrease flow downstream to those non-essential organs. But look at what happens to the main artery. You're redirecting the blood into the main artery. So now you have more blood in the main artery, returning the blood back to the heart. So you're going to go from the main arteries to the veins and return the blood back to the heart. When the amount of blood in the arteries increases, we're going to increase pressure. So the pressure gradient is increased. And remember, that will then increase flow. So don't get confused. If you have vasoconstriction, flow downstream decreases. However, flow upstream in the major arteries will increase due to an increase in blood pressure. Let's look at blood flow through the vessels. In the arteries, the pressure gradient is about 60 millimeters of mercury. And that is due to the fact that the arteries are closer to the pump, your heart. But by the time you get to the veins, the blood pressure gradient has dropped to about 15 millimeters of mercury. Recall that in the capillaries at the arterial end, the blood pressure was 35 millimeters of mercury. And by the time you got to the venual end, it had dropped to 17 millimeters of mercury. When you get to the inferior and the superior vena cava of the systemic circuit, the blood pressure is about 0 millimeters of mercury. In the veins, you don't have a significant pressure gradient, which means that you're going to have to use some other mechanisms to help return the blood back to the heart. We'll start with the skeletal muscle pump. When your muscles contract, they squeeze up against the veins. This helps increase the pressure in the veins to return the blood back to the heart. The second mechanism is the respiratory pump. The contraction and relaxation of the respiratory muscles help create a pressure gradient from the abdominal cavity to the thoracic cavity. We'll look at this later when we study the respiratory system, but this helps return the blood back to the heart. The third mechanism, sympathetic venoconstriction, increases the blood pressure within the veins. The last mechanism is the presence of valves in medium and large-sized veins to prevent the backflow of blood. The condition varicose veins is due to faulty valves. As mentioned previously, blood flow through a vessel is dependent upon whether the vessel is vasoconstricting or vasodilating. Recall that increased resistance is due to vasoconstriction. There are several chemicals involved in causing smooth muscles to vasoconstrict or vasodilate. The neurotransmitter released by the sympathetic nervous system, norepinephrine, is a vasoconstrictor. Another group of chemical messengers is your hormones. There is one vasodilator that you need to know, and that hormone is ANP, atrial natriuretic peptide, released by the atria of the heart when blood volume is elevated. There are several vasoconstrictors: angiotensin II, ADH, which is also known as vasopressin, and epinephrine and norepinephrine.